Good afternoon, everyone. Welcome to our Read Vermont webinar about assessments. I'm going to give folks another minute or two here, I think 2 minutes, to get organized and online, joining the Zoom meeting. I see more folks joining us. So once we look like we have a steady number, we'll go ahead and get started. Great. Oh, can folks hear me okay? Good afternoon. Great to see everyone okay. I'm seeing lots of thumbs up. If folks are having trouble, let us know. Great, and we will get started. And seeing a few more folks join, trickling in. So thanks everyone for joining this afternoon's Read Vermont's webinar focused on assessments. We will get started here in just a minute. Great. I think we're at 3:32. I think I'll go ahead and get started. We'll go ahead and get started. So welcome everyone. Thanks so much for joining us this afternoon for the Read Vermont webinar focused on assessment. It is a blustery one out there. So I hope you're all staying warm and dry here. So this is our first Read Vermont webinar of the new year. We'll focus on assessment throughout this webinar, but we really are, this webinar design has been, it's designed slightly differently intentionally. And really, we are really thrilled to engage in a conversation with you to understand what questions you have about assessment, and really have an opportunity to ask experts about assessment and discuss assessment with your peers. And so we see this as an opportunity to gain increased knowledge in that way, and also hope you'll walk away with some really practical tips today. So the overall flow for today is that we will walk through and provide you all with a deeper understanding of assessments and the universe of assessments broadly, and then you'll get a specific look at screening. And then really a bulk of the time we are going to spend in having a question and answer and conversation about assessment. And so I'm really pleased today to have our national experts as a part of Read Vermont. We have 2 contractors that we're partnering with to implement Read Vermont. So we're partnering with the Stern Center for Language and Literacy, and we have Lee, who is a literacy coach there, and Lori Quinn, the president of the Stern Center, on the call and joining us. And then we also have members of the literacy consulting team, and who I'm looking for among the sea of photos. We have Renata Archie and Heather Fleming with literacy consulting. And I'm going to have them go ahead and begin sharing their screen as we dive into the presentation piece of this. Before we do that, or as we do that, we're going to also launch a poll just to kick off the webinar. And to just get your input on how you're coming to this webinar. So just give you a minute here to complete this poll. All right, I'll give you another 15 seconds or so here. Looks like most folks have participated, so thank you for that. All right. Excellent. Excellent. So it looks like here we have most folks coming in around the midpoint around their understanding of assessments, and also with screening. And it looks like we have a good mix of classroom educators, coaches, administrators, and interventionists, and we have a few folks from early childhood, also some special educators and other as well. So thank you all for that, and getting oriented around who is with us today. So without further ado here, I am going to introduce you to the literacy consulting team that's going to really walk us through the universe of assessments and screening, and help lead us through a conversation. So I'm pleased to introduce Dr. Renata Archie. She is an educator based in New York City. She brings over 25 years of experience in the classroom to her work. She spent most of that time in kindergarten classrooms, and then also as a literacy coach. She's currently working at the district level, supporting a portfolio of schools with literacy assessment, data, and multi-tiered systems of support. And she takes on work working with literacy consulting as well, and also is a contributing faculty member at the Mount St. Joseph Reading Science Graduate Program. And then she also presents nationally. So I'm also pleased to introduce to you Dr. Heather Fleming, and she is the founder of Literacy Consulting. I'll let her explain more about literacy consulting, but she has experience teaching struggling readers, designing professional development related to how the brain learns to read, and also what barriers to those processes are. She loves supporting teachers and adding to their toolboxes how they can support all children to become skilled readers. And her current focus of work is really on policy and effective implementation of reading policy. And she brings to this work perspective of being a mother and having a son who has needed additional supports along the way to become a thriving reader. So with that, I'm going to turn it over to them to help us gain knowledge around the universe of assessment. And please, throughout, we welcome use of the chat here.
Yes, and we may not be able to see the questions, but our colleagues at the agency will certainly let us know. Thank you for the intro.
Okay, so good afternoon again and welcome. We are very excited to be here with you. Feel free to add your own introduction in the chat, your role, school, or district. Our colleagues from the Stern Center actually already did the poll, so that's done. If there's anything that you're thinking about, any wonderings or any questions, please feel free to drop that in the chat. And either our colleagues will stop us if it's relevant, or we'll definitely have a nice discussion at the end. So as you do that, here's our agenda. We're going to first review the learning objectives for the session, the purpose of assessment. Then we'll move to explore the continuum of assessments for learning, the purposes of screening, and we're going to discuss a few common misconceptions about screening. And then we'll close with time, as I said, with questions and some open discussion. So during today's session, we will gain a general understanding of the purpose of assessments in improving literacy outcomes and a deeper understanding of the purpose of universal screeners in particular. We're going to engage in discussion about some common beliefs and about screening. And at the close, you'll have time for questions. These slides and the recording are going to be shared with you, so you definitely have room to take some notes and jot down all the wonderings you might have. So let's get to it. So to begin, I think we can all agree that in an ideal world, assessments and the resulting data should be useful in terms of improving student outcomes. In other words, if assessment data do not help us do something that directly or indirectly improves student outcomes, we should probably consider if the assessment is worth doing. I think we also all agree that we as educators all want all of our students to become fluent and skilled readers. So the purpose of today's session is to make sure everyone has a bit more clarity about the different types of assessments we use for literacy, that everyone gains more insight on the purpose of universal screeners in particular. So consider today a very high-level overview and a conversation about assessments, and it will be laying a common understanding and a foundation for future professional learning that you'll experience in the months to come. All right, so there are various assessment types that we use in schools and in classrooms. And early in my career as a kindergarten teacher, I have to say that I was not at all clear about the purpose or the value of all of the different assessments or any of the activities we were doing. I knew it was important for the students and for instruction. And sometimes as a young teacher, I was just in a compliance mindset and wanted to get it done. So it took time, and over the years, and even to this day, I continue to learn more about the various assessment types and what they can offer us as educators in the form of rich information and how they can help us improve student outcomes. So one understanding we would like to share is that assessments can fall into two different categories. One, the first, is an assessment for learning, and the second, an assessment of learning. So in the first category, assessments for learning offer us information that's very helpful for everyday instruction. So these types of assessments, the assessments that fit into this category are formative, screeners, diagnostics, progress monitoring, which we're going to explore on the next slide. And as a general overview, this category of assessments can help us identify students or groups of students who may be at risk or not meeting specific skill targets. And they can provide information about the health of our overall school as a system. They can help identify specific strengths or needs of students or enable us to provide feedback to students. Additionally, assessments in this category can be helpful to monitor student progress with a specific skill and can be used to reflect on the effectiveness of our instructional support that we're providing. So the next category, assessments of learning, offer us information that's not necessarily useful for informing everyday instruction, but rather help us measure the impact of our instruction. So the type of assessment that fits in this category, you've heard the terms outcome or summative, or a state exam could fit in this category. So we're able to reflect on overall student performance and to understand if students have met expected goals, expectations, or standards. And these assessments also allow us the opportunity to disaggregate data, reflect on the effectiveness of the instruction of all students, including historically marginalized students, linguistically diverse students, and students who have learning differences. So let's take a closer look at the different types of assessments that fit into that first category. So as I mentioned, these are the assessments that allow educators to have a clearer understanding of how a student is doing in real time, to plan and or adjust instruction and understand how students have been progressing. So remember, this is a broad overview. We could do a professional learning session on any of these assessment types. So continue to jot your questions and wonderings down. So first, formative assessments are intended to provide feedback to teachers and students about learning. And this could be in the form of quizzes, discussion, peer feedback, drafts, exit tickets, observations, concept maps, and checks for understanding. Next, screening assessments have a few purposes and offer educators a wealth of information. They're intended to provide us data about whole class foundational reading skill proficiency. They help us understand which students may benefit from opportunities for early intervention. Screeners are not intended to provide detailed information and do not pinpoint exactly where the issue may be, but they rather offer information about how students are doing with essential skills that are predictive of future reading achievement. So they give us a general zone for concern and help us know what additional information may be needed. So a screener can be equated to taking someone's temperature or blood pressure. So we know when we have a slight fever, we're aware that something maybe needs to be addressed, but not exactly what. So screeners also provide information about which students are meeting and exceeding benchmark expectations and would benefit from enrichment. Pardon me. Not only give us information about individual and groups of students, they also help us reflect on the health of our instructional system. So for instance, if a large number of students are struggling with a particular skill, it does not necessarily mean that all the students cannot do the skill. It may indicate that a need for more robust practice or opportunities for practice for the whole class. It could mean a need for professional learning or a review of the curriculum materials that are in use. So this is what we mean when we say screeners can help us reflect on our system. Next, diagnostic assessments. So this type of assessment offers the opportunity to dig deeper and to understand exactly where a student needs support. Diagnostics are not administered to all students, as this would overwhelm our school-wide assessment system. They're typically done after screening when we may need more information to construct responsive instruction for a student. A diagnostic can be as simple as like a letter sound inventory that takes a few minutes, or it can be an extensive inventory or survey that pinpoints specific skills. So a diagnostic helps determine what the exact skill need is, what skill needs to be addressed during intervention, and the skill that maybe we are going to watch when we're progress monitoring. So that takes us to our last type of assessment, which is progress monitoring. Progress monitoring is probably the most complex type of assessment and probably what we get called most to assist and support educators. It's more of not just an assessment, but a process. Progress monitoring is done with students in smaller groups who may be receiving intervention. So it's done in tandem with intervention and focused on a skill. Educators regularly review progress monitoring data to ensure that the instruction that they're providing is causing growth. Progress monitoring data is used to make decisions about if instructional activities or even grouping should stay the same or if it should change. And the frequency of progress monitoring may be weekly or bi-weekly, depending on the intensity of the intervention a student is receiving. So I hope this slide helps clarify how different assessments can inform instruction, make sure our instruction is responsive, and ensure students experience positive outcomes. So my colleague Heather is going to explore a bit more about the purpose and the value of screeners.
Thank you, Renata. So we'd like to take a deeper look, as Renata said, about kind of the one type of assessment specifically and hone in on screening. We thought it would be important to highlight the roles that screening can play, and many of you are probably familiar with these. I do love the analogy that she used about I like sort of ways to remember a sequence of or a continuum of anything, including assessments. And so, like, screening is like if you don't feel well and you're flushed and you take your temperature, you might be able to see that I may not be feeling well. You can tell I'm flushed or maybe tired. But then we have to do diagnostics. We have to, for example, maybe do blood work to understand what's causing me not to feel well. And then we maybe provide antibiotics. That's the intervention. And then we watch the symptoms, or maybe we redo the blood work, and that's the progress monitoring. I'm sorry if a medical analogy is not appealing to people, but for me, this helps sort of just draw out the continuum. People, you may or may not be aware that a child who struggles to read at the end of first grade has an 88% chance of continuing to be a struggling reader at the end of fourth grade and also in high school. This was pretty surprising to me when I learned this, that there are a couple studies that show this, which really emphasizes the importance of catching kids early. You know, there's a really steep learning curve in the first couple of years of school, particularly around reading. And so, you know, kids, there are a lot of opportunities for them to fall behind during that period. So this again just speaks to the importance of screening. Again, maybe stating the obvious, it is easier and much more effective to ensure that we're really teaching foundational skills to mastery than it is to remediate later reading difficulties. And, you know, you can see this, and it's not specific to Vermont, but across the country, the percentage of kids reading proficiently doesn't really change after third grade. Universal screening provides us with the information that is really the starting point for providing responsive and differentiated instruction, and for stakeholders to make strategic systems level decisions like Renata referred to. And your General Assembly recognized the importance of universal screening in passing Act 139 that requires universal screening in K through 3, and also directed the agency to review screeners and provide screening guidance.
Okay, so we added in, so in my work, to give you a little background, in my work in New York and in other states where I've supported teachers and leaders who are using screeners or interpreting the data. And I have a graduate course that I teach that is focused on assessments and screeners with students across the nation and some internationally. So there's some very common misconceptions and things that we may hear or encounter out in the field. So we thought it would be appropriate to put a few on the slides and let you think about them. You may end up in collegial conversations in your schools where you need to discuss these or have some good responses to them. So we're going to share some of the misconceptions with you and have you think a bit about how you feel about it or how you would respond to it. And then we're going to give you some additional information that would be valuable for you to have in hand. So here's the first misconception that we hear in the field often. The only purpose of screening is to identify students who struggle. So after listening to this few slides that we shared already and considering what you understand about screeners, we'd love for you to jot down or share in the chat what you think about this statement. Give you some time. I can't see the chat.
I think you can just continue.
Okay. So even if I continue and something pops up, please stop me and let me know. So this is something we hear, and it's a yes and no. Screeners can help us hone in on on which students may need a little additional support or may have a skill need. But the bigger thing that it does is it helps us know who would benefit from support, who would benefit from enrichment, and areas in which the whole class may benefit from additional instruction. And additionally, the systems level piece is very important. That's something we see a lot here in my district, where we may see full classes or a large group of students who may need a certain type of support. So that helps us inform decisions school-wide. Here's the next misconception. I think, Heather, you're going to share that one.
We now have all sorts of good comments in the chat. I'd love to get to a couple. That is only identifying students who are struggling is only one function of screening. Absolutely, it can help to see if instruction is effective. You know, screeners can be used in many ways. Another way is to look at how far students are above grade level, for sure. It can, again, to that point, identify students who again, are just above grade level. One person says that sort of commonly held misconception seems to be short-sighted. I think we would agree. It can give a quick view of all learners and may show some students who may be having difficulties, can identify maybe difficulties or needs in whole class instruction. Anyway, these are fantastic.
Absolutely great.
So thank you for that.
Yes. All right, you ready for the next one?
I am.
Okay.
So here's another statement that is often also a misconception. And again, you can feel free to share your thoughts on this. Screening assessment takes a long time and creates a lot of extra work for teachers. I think there's a little bit of a lag between when people post things and when they kind of pop up.
Okay.
So I'm gonna move on to the next, and then they're meant to be quick and targeted. Yes.
Great.
They can be brief and can streamline some of planning. It shouldn't take too long if it's administered to whole class. That's a really important point that I'd love to come back to. Sort of, are we prioritizing minimizing, in different contexts, sometimes it's important to minimize teacher administration time. And sometimes you have enough teachers to be able to minimize student time, and you may pick different screening tools depending on what your resources are in a particular district. It says screeners should be targeted, give quick snapshots. Absolutely, should be quick. It can definitely feel like this is, I appreciate this. It can feel like a lot of work when you're pulling kids aside one by one, but can really save time in unnecessary or inappropriate instruction. These are great. Thank you so much for engaging in that.
Yes.
So additionally, and this just repeats everything that you all have said, that effective universal screeners are designed to be efficient. They should highlight, really critical, that should give us insights about critical skills with a focus on minimizing assessment instruction. And in order to increase efficiency, screeners really should offer, and hopefully districts provide teachers time to do training in their use. And many of your schools may do this, but a lot of schools will train, a variety of educators in the building, including support staff, to try to reduce some of the burden on classroom teachers. So after seeing this, I think you've already kind of shared this, but we were wondering, if you had any thoughts to share that you're willing to share in the chat about the screening process or screening assessments that are used in your district or school. And we realize people may not want to do that on this, but.
What I'll do is go to the next one, and if they react to what you just proposed, and then this last misconception, I'm sure we're going to get a lot of feedback on this one. So this last one says, teachers instinctively know which students are struggling. So we'll give you some wait time and see your reaction to that one. And Heather, just jump in and let me know what you see. So I'm sure people are typing, but many teachers, yes, will have we all have a wonderful idea of where our students are and who might be struggling. When I visit teachers in my district and support them with assessment and data, we always have these aha moments, because the screener can match exactly what you understand about students, but it's giving you some very granular information. Also, you can have some big surprise moments. I've seen that a lot, where one of our, some of our most strongest, most fluent, skilled readers, it still gives us some insight into where they may need some support.
There's some great comments coming in. May I interrupt you, Renata?
Please read.
It's the ones we miss that need the most help. I don't, not at all really. I have some quiet kids who seem to be fine, and they're actually really confused and lost. And that is very typical. Again, I don't need to tell you all, but some kids just kind of turn inside when they are overwhelmed or don't understand. This is very interesting. I work with deaf, hard of hearing students, and they are masters of faking understanding. Kids have an uncanny ability to say the right thing to give the impression of comprehension when the depth of their understanding is very surface. That is my experience. Also, I taught in a school that serves students with dyslexia, and these kids are bright, right? And they know how to try to convince you that they do understand. Students can be very good at hiding their struggles. That's right. And they're also, as you know, kind of hurting emotionally when they're trying to hide their struggles. While it may be fairly obvious for some, many, again, can hide their struggles, can help form instruction. This is very interesting. The intuition may not be calibrated to criteria of grade level standards. That's just really insightful, and exactly the point. Like you may have a sense of you certainly have a sense of how your students are doing, but do you have kind of the exact information about what a student may be missing? Anyway, these are incredible. Thank you. You all are such every time we present to you, and I know the Stern Center would echo this, you're all so engaged in these sessions. It's really delightful to have the opportunity to partner with you on this.
Yes.
So sorry, Renata, continue. I interrupted your.
No, that was wonderful to hear. I love that the statement just create an avalanche of thoughts and wonderful insights there. So everything that you have put in the chat is spot on. So the purpose of, we just had these 3 little misconceptions. The purpose of bubbling those to the surface is to really, you will be in conversations with colleagues, whether you're a teacher, a coach, or administrator, where you'll have to discuss and explain. And, across the months and the years, every time something is implemented or something's new or being introduced, these kinds of things have to be discussed. So like Heather said, that's delightful to hear your reactions. And we're going to turn it over right now to our colleagues at the agency to do some question and answer and hopefully hear your voices, any wonderings you have, or any comments that you have.
Excellent. Thank you so much, Renata and Heather, for this broad overview, and all of you for this tremendous discussion. I'm seeing more come in here, and the common themes around from this last question really spark a lot of ideas and important pieces for conversation. So we can dive in here, but for the rest of our time today, we really are going to focus on this opportunity to ask our experts, our national experts, Renata and Heather, as well as the experts at the Stern Center, as well as all of you. You all are experts in what you do every day. So an opportunity for you to get advice and tips, problem solve together with your peers around assessments. So I think given the nature of the engagement here, I am going to go ask folks who have a pressing or burning question that they'd like answered to just come off mute here and put it into chat. Also, you're welcome to put your question to type it in if you prefer that way.
I'm just going to add while people are thinking. Go ahead. Sorry.
No, go.
Oh no, this is a rabbit hole. I know everyone thinks that it's cold right now in Vermont. I want you to know that I recently moved from Wyoming to Tucson, Wyoming, where it's obviously very cold and snowy, to Tucson, Arizona, where it is not cold and snowy. And this morning when I woke up, I was convinced that it was about 25 degrees outside. It was so cold for me. It was 51 degrees. I don't know if I just turned into a 90-year-old when I arrived here. I'm not sure how